It's time now for Countywide, a special presentation of Yavapai Broadcasting News. Join Paul David and Kyle Benedict as they talk with our community's leaders, newsmakers, and people in the know. You'll hear about the hot topics that affect all our lives in Yavapai County. And now here's today's Countywide.
Hi, and welcome into another edition of Countywide. I'm Kyle Benedict, news director here at Yavapai Broadcasting. And today we're talking about immunizations, and joining me right now is Public Health Medical Director Yamini Goswami. She's joining me right now. Thank you so much for being with me.
Thanks for having me, Kyle.
Now, you're here to talk about immunizations. This is a popular topic of conversation right now. And before we get into that, you're also a family doctor. Can you talk a little bit about how you, first of all, your practice there and how you kind of got into this new position of medical director?
Yeah, great. I'd love to. So I've been a family doctor since 1997 when I graduated from my residency. I actually moved to Arizona from Ohio to start private practice there. But to make a long story short, I ended up back in Arizona after moving back to the Northeast in 2000 to join the Indian Health Service, and I've essentially worked in the public health field ever since 2002. And I actually was a family doctor in one of our public health clinics in Cottonwood in 2010 and moved into my new role in February of this year. Okay. When our director asked me to become medical director.
Great, well, congratulations.
Thank you.
And just again, talking about immunizations here, school is coming back in session soon here in this kind of region and area, and that means many kids and students are getting their required shots in order to enter the public school system. So why is it so important that they get these shots, and why is it required?
So it's really important that parents, as they make their checklist for back-to-school supplies for their kids, don't forget to also make one more checklist for their child's health. It's important that children get their required school immunizations because it does protect children from potentially life-threatening diseases, so serious and life-threatening diseases. And not only does it protect your child from these serious diseases, but it also protects their classmates, and it also protects the community from these diseases by preventing the disease from spreading.
And what are some of these diseases that they are getting vaccinated for?
So some of the diseases are polio, measles, which we've heard so much about in the news lately, meningococcal meningitis, which some of the older kids get at age 11, mumps, rubella, diphtheria, pertussis, whooping cough.
And it's important to know that while we're not seeing the effects of all these here in this country or, recently, it's still important because why is it so important to get these for some people who maybe think that, we haven't seen a case of this disease in a while? Why is it important that we get vaccinated for it?
So actually, we have started to see a resurgence of some of these infectious diseases. Measles is a good example of this. Since January 1st, the CDC has reported that we've seen 585 cases of the measles in this country. That's the largest, that's the largest number of cases since it was considered eliminated in this country in 2000. So this is a real situation. This is not something that's theoretical, and while we don't want to scare people, we have a great way of preventing these diseases from becoming epidemics, and that's through vaccines. In fact, vaccines are considered one of the greatest public health achievements of the 20th century.
And how do vaccines actually work? I mean, for just kind of summarizing it a little bit, just down to the bare bones, how do they work?
Sure, that's a great question. So they work on two levels. One is that they actually protect your child or the individual from the disease itself by creating an immune response. So that way, it's almost like forming a shield of protection or having armor against the disease. So that way the body recognizes the diseases so it doesn't react to it. It can mount an immune response to make it fight the disease. The second way that they work is through something called herd immunity, or a better term is community immunity. And the way that works is if you have the majority of your community immunized or protected against some of these diseases. Let's say 90 to 95% of people are immunized. The disease has a much less likely chance of spreading because the majority of people in the community are protected if they're all immunized. So that way, let's say there's a person who can't be vaccinated, okay, for medical reasons. They have cancer or they have an allergy to the vaccine. The people around them who are immunized actually protect the person who's not immunized.
So it benefits the majority? Absolutely.
Okay. Absolutely. Protects everybody.
And with these, I mean, you just mentioned it. I mean, here in Yavapai County, we kind of have, there's out of the state, what you said that this is the largest county with the most amount of people not with exemptions, I guess, right?
That's correct. So there are 3 different types of exemptions that are available in Arizona. There are medical exemptions for people who have medical reasons why they can't get vaccinated. Then there are religious exemptions as well for people with religious beliefs that don't allow them to get vaccinated. The Amish are one example of that. And then finally, there's something called the personal belief exemptions, and that's for people who have strong concerns and personal beliefs against getting vaccinated, that they can actually sign to opt out of getting vaccines. So we don't recommend the personal belief exemptions if you really are on the fence. We recommend that you speak to your doctor about any concerns you might have about vaccines. But what we're starting to see is the personal belief exemption rate is on the rise. Yavapai County's personal belief exemption rate is 10.9% for the 2013-2014 school year. Arizona, the state average is 4.7%, and the national average is around 2%. And the reason why this is a concern is because that threatens that herd or community immunity that we were just talking about. Because as we drop below the 90% threshold, that actually threatens that protective shield that the community immunity provides.
Okay, great. So, I mean, it's just a sense of kind of making sure that we're trying to get as many people vaccinated as we can, right?
That's absolutely right.
So how, if you're a family member who does have certain exemptions, how do you go about proving those, or, you know, to the school system when you show up without shot records? How do you prove that there is a reason for that?
So for the medical exemption, they do need to go to their doctor or nurse practitioner and have them sign off on the form. For the religious and the personal belief exemption, there's a form that the school can provide, and it's actually created through the Arizona Department of Health Services, where it actually describes all of the vaccines that are required for school and recommended, and the parent would have to actually read every single disclaimer for the vaccine and then sign off on that form. But again, we don't recommend that you just sign the exemption form. We recommend parents educate themselves about not only the vaccines, but about the diseases that the vaccines are trying to prevent, and really arm yourself with the scientific research. And if you're unsure, the best trusted resource that you have is your child's doctor. Have a conversation with your child's doctor.
Okay, great. And just real quick before we take our first break, it's going by fast. How long do these vaccines last? The ones that are required for school?
Okay, so most of the required childhood vaccines are believed to confer lifelong immunity. There are some exceptions to that rule. The DTaP, which is the diphtheria, tetanus, and acellular pertussis, is required through age 6, but then there's a booster dose that is required at age 11, because what happened was, in the past, the pertussis or whooping cough vaccine used to be a live virus, but now it's no longer live. And as we move to the acellular form, because it caused less reactions, that's why we moved to the acellular form. It didn't confer quite the same length of immunity as the live virus did. So that's why there are some boosters out there.
Okay, great. Well, we're going to take our first break, and then we'll be back talking with Public Health Medical Director Yamini Goswami here on Countywide. We'll be right back.
There's a shelter pet who wants to meet you. Meet one today. Visit theshelterpetproject.org. Adopt.
So you can't save money? That's easy as pie. Brown bagging lunch instead of going out. $6 save times 5 days a week times 10 years is $21,000. That's a lot of lettuce. Small changes today, big bucks tomorrow. Feedthepig.org.
Good one, son.
Last summer, my new dad took me on vacation. First, we went deep sea fishing.
Wow! I'm so proud of you, son.
And then we went on Thunder Shark.
That was awesome! Let's go again!
3 times. I gotta say, it was pretty cool.
You don't have to be perfect to be a perfect parent. Thousands of kids in foster care will take you just as you are.
Oh, not again.
We need a claim number?
When I started taking care of Mom, I didn't realize the challenge of playing so many roles. But above all, I'm still her daughter.
Visit aarp.org/caregiving. We're here to help.
A single ember from a wildfire can travel over a mile. You can't control where it will land, only what happens before it does. Visit fireadapted.org to learn how to protect your community from wildfires.
So, I'm kind of new here, but I've noticed a trend. My human does this funny thing where she goes around and gets all my toys, and then she hides them in that basket by the door. It's like, hello, that's where you put it last time. You were the worst at hide and go seek.
Take my hand and start a brand new day.
Underneath everything we are all people. And when we reach out a hand to one, we can influence the condition of all. That's what it means to live united.
Welcome back to Countywide. I'm Kyle Benedict, and I'm sitting down with Public Health Medical Director Dr. Yamini Goswami, and we're talking immunizations with school back in session here in the next coming weeks. Those kids are getting their required shots for the public health system, and I think with these vaccines and immunizations, one of the most popular, and I think one that everyone knows about, is familiar with, is the flu vaccine and the flu shot. Can you tell me a little bit about the benefits of that and why this is one that is so common?
Right. Well, that's a great question. The influenza is an actual disease that has been around for a very long time, and back at the turn of the last century, of the 20th century, the influenza outbreak at the turn of the century actually killed many, many people. And so from that, we've actually developed a vaccine to protect people from a potentially life-threatening disease. It is a virus. The two most common strains are influenza A and influenza B. And that's what, when we make the flu vaccine every year, we target it to the two most common types, which is type A and type B, as well as looking at strains that are emerging. And the flu vaccine is recommended for all people 6 months of age and over, and it is a yearly vaccine. One exception is for children between the ages of 6 months and 8 years. If it's the first time that they're getting their flu shot, they actually need 2 within the same season to protect them.
And there's different types of flu vaccines, correct?
There are. There's a live activated influenza vaccine, which most commonly people see that in the form of a nasal spray, and that's what we tend to give children. There are certain groups that can't get the live vaccine. There are people with conditions like cancer, people on chemotherapy, or weakened immune systems. And then there's the inactivated influenza vaccine, which we have different forms of, and that's the form that most people do get. And the flu vaccine actually does work. Remember, it's protecting you against a potentially life-threatening disease.
Now, there are some people have concerns with the live vaccine. What are some of those concerns that they have, and maybe how can you almost reassure them that it's not more dangerous than any of the other types?
So the live vaccine is actually a purified form of the actual virus that the flu is caused by. And
that's what scares so many people.
Right, but here's the thing, the vaccine itself is purified excuse me, and sterilized so that it actually can't harm you. Now, why we don't give it to some of the people that I mentioned earlier, the people that have immunocompromised disease states, is that that virus, their immune systems are not strong enough to combat the very, very tiny risk of them actually contracting the flu themselves. People with healthy immune systems, that risk is very, very rare. So I want to reassure people that you really can't get the flu from getting the vaccine. And the live vaccine, just as we had mentioned pertussis in the earlier segment, it protects you in a way that, for instance, if you got the flu, the actual disease, you will have a better immune response to it. So it protects you better.
So it doesn't quite give you the flu.
No.
But there's people who say once they get the shot, the next day or the next couple of days, they feel like they have the flu. Why is that?
Right. I'm glad you mentioned that, actually. So a lot of people, a lot of my patients actually have come to me and said, I got the flu the last time I got the flu vaccine. Well, actually what it is just as if you got the flu, your body would be mounting an immune response, fighting off the effects of the disease. When you get the vaccine, that's actually a sign that your body is adequately mounting that immune response. So you're not actually getting the disease, it's your body fighting to recognize the fact that now it's building immunity to the flu. And usually those symptoms or reactions are very mild. They may last 1 to 2 days. The other thing is we give the flu vaccine during flu season. And that's a time when people are in close quarters, especially children in schools. You know, children don't generally wash their hands. They don't cover their mouths when they cough.
No matter how much you tell them, right?
Yeah, exactly, and it's spread through the air. So a lot of people actually may be getting cold symptoms, and they confuse that with the flu. Less than 1% of people who get the flu vaccine actually go on to get the flu. It's perfectly safe.
And switching gears here a little bit, I think it's important to talk about in the recent news. There's over in West Africa, the Ebola outbreak. And this can serve as a reminder to many people here, even though we don't have too many cases of it here, or actually any cases really of it here. It's still a reminder that these viruses can pop back up, even though they might seem like they're dormant. They can make a comeback. And so what can we take from what's happening over there and kind of, apply that to our vaccinations and immunization kind of knowledge in the States here?
The Ebola virus is very deadly. It's actually a form that, as we've seen, there have been multiple deaths in West Africa. And I think the way that we want to look at this is that diseases like Ebola are just a plane ride away. In fact, just on the news this morning, I heard that an American was flying from Nigeria to Liberia and actually died in Liberia from the Ebola virus. Had he not died, he actually would have been coming back to the United States, and then we would have had our first case in the United States. So in order to really protect yourself, because there are no physical borders in the world anymore, the vaccine is the best option we have. Unfortunately, we don't have a vaccine for Ebola. I know that they're trying to develop one, but we do have vaccines available for diseases that can also kill, like the measles.
Great. Well, that's Public Health Medical Director Dr. Yamini Goswami, and we're talking immunizations. We'll come up and wrap everything up when we come back.
Separate raw meats from other foods by using different cutting boards. 3,000 Americans will die from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.
Hi, I'm Jacqueline. There are now more registered voters in Arizona who say that they are independent than those who claim a particular party. If that's you, independents can vote in the primary elections after they select a party ballot. You fill it out and mail it back. If you vote at your polling place on Election Day, they will ask which ballot you'd like. Even though you're not a registered party member, your right to vote is protected and your vote will count.
A message from the League of Women Voters of Arizona.
Okay, so we drowned the fire, stirred it, drowned it again, and now just feel if it's cold.
Yeah.
Cool.
Smokey just gave me a bear hug.
I know. I already posted it.
There's a shelter pet who wants to meet you. Meet one today. Visit theshelterpetproject.org. Adopt.
Welcome back to Countywide. I'm Kyle Benedict, and we're talking immunizations with Public Health Medical Director Dr. Yamini Goswami. Thank you again for joining us. And before we went to break, we were talking about the Ebola virus outbreak over in West Africa and how that's already claimed a number of lives. And I guess my next question following up with that is, what would happen if, say, someone over there got the virus, they got on a plane, landed over here in the States? What would happen? We don't have a vaccine for it.
Right. The good news is, because our country has such a great infection control program, our hospitals are safe, we have a good way to quarantine people, the likelihood of Ebola spreading in this country is almost nil. So we want to continue best practices, we want to continue safety measures, and bringing it back to the topic of the day, vaccine preventable diseases, we want to make sure that we all take the right precaution against preventing diseases like the measles from making another resurgence. We want to remind parents to please take your children to your doctor to get their vaccines updated for school. Check with the schools have the records as well. And I also want to mention that Yavapai County Community Health Services has 3 clinics, one in Cottonwood, Prescott, and Prescott Valley, where we have special dates and times set aside for immunization clinics. We have public health nurses that can give you vaccines if you can't get in time for your child to see the doctor before school starts. The only thing we ask is that you call and make an appointment. All of that information is available on our website, yavapaihealth.com, where we also have links to trusted and reliable resources for parents on websites that talk about immunizations, websites like immunize.org and whyimmunize.org.
Just for more information.
For more information, yep. And the CDC is also a great resource. If you want to learn more about Ebola, the CDC has a lot of information up on its website as well.
I saw on their website, I was actually on there kind of just doing a little research, and they have a nice table of pros and cons for people who, you know, it kind of answers a lot of the questions that people have regarding immunizations and vaccinations. So thank you so much for being here with us. It was very informative and very timely with school going back into session.
Thank you for having me, Kyle. It was my pleasure.
Thank you. That is Dr. Yamini Goswami, Public Health Medical Director, and we were talking immunizations here on Countywide. Thank you for joining us. We'll see you next time.